Welcome to the Network Towards Unity for Health. My name is Bill Burdick, and I'm the Secretary General of what we know as TUFH or TUFH. TUFH is a non-state actor in official relations with the World Health Organization, and we support the strategic priorities of TUFH, that is, achieving 1 billion people benefiting from universal health coverage to achieve WHO's desired outcome of improved access to quality essential health services. TUFH was started as an entity of the World Health Organization in the late 1970s as the network of community-oriented medical schools. It merged with another WHO initiative 20 years later called Towards Unity for Health, hence the mashup name of the Network Towards Unity for Health. We have had history that goes way back, and we are proud to continue that legacy through the enduring future.
Hello, I'm Nicholas Torres, and I'm the president of the Network Towards Unity for Health, TUFH. And TUFH plays three roles in the global health arena. The first is a certification role. We work with school institutions across the world, medical and other health sciences schools, to certify them in social accountability. We also work towards the certification of the workforce. Through the certification of the workforce, we increase the benefits and health for individuals receiving these services. Our second role is in global learning. We have many venues to advance global learning. The first is we've created task forces or global communities of practice on 6 priority groups. Second, we host our international annual conference. We do an international student exchange, and we publish 2 journals, Education for Health and Social Innovations Journal. And then our third primary role is in increasing the local infrastructure and their impact. And through this, we have national centers of excellence, which are really chapters of TUFH in different countries or regions. We host a social accountability fellowship, which is really about leadership in terms of driving the mission of TUFH. We have a teaching fellowships, which is helping those, again, within their region or their countries, replicate TUFH's teaching and its academies. We have a mentorship program, and then we have a student leadership institute capacitating the students within their institutions to also lead. When we look at the social accountability tool, or what we call ISAT, it's based upon many components or standards, of which case an institution will self-assess. And through the self-assessment, they develop an internal report card or a baseline of where they are within the global social accountability standards, and then they develop a plan of action of how to move forward to the next phase, with the whole idea that they were responding to people and society's needs. TUFH provides an external recognition. The first phase is a validation, which is the assessment's completed, the institution has a plan of action, and there's a peer review process where we bring together your peers to provide feedback for that. And then within 3 years, it's more of a certification process, which you look at the impact or the societal impact that your institution has had because you've taken this journey of social accountability. The other factor that we play with is global learning, which is the communities of practice. So our 6 communities of practice are remote and rural, indigenous, migrant or refugee, women's health, IDD, mental health, and autism, and aging. These are our groups that come together. We assemble global leaders across this, produce publications, and through those publications, hosts TUFH Academies, which provides an avenue for people to learn with and from each other and increase their workforce competencies. And then we take these and then provide them as vehicles or technical tools to our centers of excellence. And then our last is our centers of excellence, which is really building this local infrastructure. These are basically TUFH chapters, and they play a crucial role in driving national policy, building capacity, and offering technical guidance and disseminating key information to support and strengthen the primary healthcare approach worldwide. They really focus on 3 things. One is meeting the social accountability and interprofessional education and collaborative standards for their institutions and the collaboration within the country, increasing the knowledge and skills and competencies of the primary care workforce through the communities of practice and their publications and courses, and then connecting them to each other to learn from, with, and from each other so that it becomes a global effort or a global movement.
Hello, I am Aricia de Kempeneer. I am the Vice President of Operations and Programming at TUFH headquarters. I'm here to tell you more about why you should join the TUFH annual conferences. They're a global gathering that unite health professionals, educators, and students who want to advance equitable, community-oriented health. Since 1979, its unique format with keynotes and workshops, TUFH talks, documentaries, oral presentations has connected people across boundaries. Through its unique format of Conference on the Move, attendees directly engage with local communities as well as health organizations. Beyond learning, it's a space to build connections, to celebrate cultures, and to drive change in health equity. You should register for our upcoming annual conference and be part of this change. Our global community platform, TUFH.org, is a platform designed for all TUFH members where they can connect, learn from each other, share knowledge. It also serves as a place for collaboration and networking for all of TUFH members across the globe. Education for Health is the peer-reviewed Medline Index journal of the network TUFH. It focuses on global models of health system integration and health professions education that lead to improved health and healthcare delivery. TUFH also publishes yearly in the Social Innovations Journal that is dedicated towards social innovators and entrepreneurs and aligns them towards collective social impact goals and public policy. This is your opportunity to join TUFH today. As an individual or an institution, you can connect, collaborate, and lead global innovation in transforming education and health for all. You can reach us at secretariat@thenetworktuf.org, or you can visit our website at thenetworktuf.org.